The Biden administration is proposing a new rule that would have popular weight loss drugs like Ozempic covered by Medicare and Medicaid. Public health insurance programs already cover the medications for some people with diabetes. But this proposal would allow anyone considered obese, meaning a body mass index of 30 or higher, to also qualify for coverage. The Centers for Medicare and Medicaid Services, or CMS, says 22% of Medicare recipients fall into that category. Without insurance coverage, these weight loss medications come with a notoriously high price, some costing $1,200 a month. CMS estimates the proposed rule would cost as much as $35 billion over the next 10 years. CBS News medical contributor Dr. Celine Gounder joins me now. She's also the editor-at-large for public health at KFF Health News. Doctor, these drugs have been in the news for months now. What is the idea behind this, allowing more insurance coverage so more people can essentially afford this medication?
So this is really a recognition, a formal recognition that obesity is a chronic medical condition, that taking these medications is not just about weight loss to look more attractive, et cetera, but really that it has an impact on your health. And what we are seeing is accumulating evidence that whether you're talking about diabetes or cardiovascular disease, stroke, kidney disease, dementia, different kinds of arthritis, we are seeing that these medications have a really beneficial impact for people who have obesity.
Well, as you know, President-elect Trump has picked Robert F. Kennedy Jr. to lead the Department of Health and Human Services, which encompasses the Centers for Medicare and Medicaid, among other agencies. Kennedy was on Fox News in October. He was asked about a similar bill to this proposal that would have covered weight loss drugs. Let's go ahead and listen.
That alone will cost $3 trillion a year. If we spent about 1/5 of that giving good food, 3 meals a day, to every man, woman, and child in our country, we could solve the obesity and diabetes epidemic overnight. A tiny fraction of the cost.
What is your reaction to that? Is it that simple?
Well, look, the GLP-1 drugs, these weight loss drugs, they're not the silver bullet. Clearly, diet and exercise has not been the silver bullet either. I would talk about it as being silver buckshot. We need a lot of different solutions to chip away at this. The Biden administration, the FDA, has sent to the White House proposed guidelines for front-of-package food labeling to make it much more clear to consumers, hey, this food is healthy or not healthy. It's really hard sometimes to read the fine print and figure out what all of that really means. We were waiting to see if the White House signs off on that, but that would be another strategy for addressing the obesity problem from another perspective. We also know that the incoming administration has Medicare and Medicaid in the crosshairs for budget cuts. And so something, a rule like this that would, with respect to the weight loss drugs, that would increase spending by Medicare and Medicaid really don't seem very consistent with those plans to cut the budget.
So you think it's probable that when the next administration comes in, it would get rolled back? I mean, you understand sort of these public health rulemaking better than anyone. How long would something like this take in order to come into effect? Will anyone even feel the effects before the next administration comes in?
So with respect to the weight loss drugs, the Trump administration would have to finalize that. So that would not be until after inauguration, based on the current timeline. With respect to the FDA food package labeling, assuming the White House signs off, then you would have to open that up for public comment. And again, it would be the Trump administration that would finally act on that. So first of all, we're talking about months to years in some cases with Medicare and the weight loss drugs. We're talking about 2026 at the earliest.
Okay.
But, you know, even so, a lot of this will just depend on how the politics play out in the incoming administration.
Okay, Dr. Celine Gounder, thank you.